koutou katoa, nā mai haramai ki tēnei hui e parangi, ko Craig toka ingoa no Ikoporu aho. Good day and welcome everyone. My name is Craig Bleckley and I'm the safety risk consultant here at Ikoporu. It's really great to see so many people taking the time to expand their health and safety knowledge with us here today. We firmly believe that we all win when we share and collaborate on what works to keep people safe. So we regularly host safety leaders and experts in an effort to share knowledge across the HSEQ and business communities. In today's session, we are pleased to welcome a wonderful panel of experts. Roberto C. Garcia, the lead partner, mental health and psychosocial risk management from Australia, and Samantha Thomas, senior manager, environment, health and safety, EHS from Auckland. The team from EY will be sharing their knowledge on a tremendously important topic by unpacking the ambiguity of well-being and how this impacts our understanding of mental health in the workplace. This is particularly good timing as we've just observed Men's Health Month, with mental health being a critical consideration on everyone's minds. So without further ado, it is my pleasure to introduce today's speakers. Roberto is the lead partner of EY's Mental Health and Psychosocial Risk Management Service, helping organizations address mental health and psychosocial stress in the workplace. He focuses on proactive risk management, leadership development, and integrating mental health initiatives into business practices, including work redesign and the use of digital technology. Samantha is a senior manager at EY in the environment, health, and safety team. She specializes in mental health, safety, and well-being, helping organizations adopt sustainable practices that prioritize people. Samantha focuses on improving workplace culture and dynamics, ensuring they contribute to positive outcomes, and highlights those in safety reportings. Two great bios there. Welcome, Roberto or Bert and Samantha. Thanks for joining us.
Thank you so much, Craig. I am very excited to be one of your hosts for this discussion today. So just to recap, introductions, my name is Samantha. I'll be one of your speakers. I'm a senior manager based in Auckland, New Zealand. I've also got Roberto with me, or Bert, as I'll probably call him, a partner from Australia, located in Melbourne. I would really like to kick off today by acknowledging the owners of the land in which we are all meeting today. For myself, that's typically Tamaki Makaurau. However, today I'm located in Melbourne, so extending that welcome also and that acknowledgement to the Wurundjeri people of the Kulin Nation. Today is a very exciting topic and something that me personally, I am very passionate about in terms of workplace mental health and some of the challenges that we're in a really privileged position in seeing across all of the different organizations that we're working with in terms of managing mental health at work. A little bit around some of the key points that we are going to be covering off on. So the first one is we really want to, like I said, unpack some of the challenges that we see relating to mental health in the workplace and talk through some of the things that we see in the organizations that we work with. We want to highlight the importance of having really clear definitions when we're talking about workplace mental health and also having some targeted strategies in place for managing mental health in the workplace. And we also want to touch on the importance of the role of governance in managing psychosocial risk as well. So we'll get into that a little bit further. If we start to even dive into some of the specific definitions around well-being, even then we have a whole lot of varying definitions. So we have things like hedonic well-being. So that's well-being more focused on happiness and pleasure. Often when we're looking at hedonic well-being, we're thinking about the presence of positive emotions and the absence of negative emotions. So that's just one definition of well-being. You also have eudaimonic well-being. So that, on the other hand, is more around self-realization and living in accordance with your values. So if we're thinking about eudaimonic well-being, we might be thinking about concepts like autonomy, like mastery, like personal growth, thinking about your purpose in life. So already I think some of the definitions of well-being that you have all touched on today touch on these two different definitions of well-being. Often, as we know, well-being is also used as a term to specifically refer to mental health only. So another definition that we have for well-being. In the context of the conversation that we're having today, we want to focus specifically on the mental health aspects of wellbeing. To distinguish between wellbeing as a broader concept and mental health, I'm just going to use the World Health Organization definition. So, WHO defines mental health as a state of wellbeing where an individual realizes their abilities, they cope with normal stresses of life, and can work productively. So, after looking at all of the different definitions that we have for wellbeing, why is this a challenging concept in our working environments? That's what we're here to unpack. In all of the different definitions that exist for wellbeing, the term wellbeing encompasses so many different factors and it means so many different things to different people. In an organizational setting, that obviously can cause some specific challenges in terms of actually managing wellbeing, which I just want to spend some time unpacking with you all. So, the first challenge is that the term wellbeing is too broad. As we've seen, wellbeing can include mental wellbeing, it can include your physical wellbeing, it can include social, it can include economic aspects. From an organizational perspective, some of these factors are out of our control. And if we're working in an environment with finite time and resources, broad doesn't always mean better. The second challenge is the impact that it can have on taking a mental health focus or taking a targeted approach and focus to mental health. Again, by focusing too much on the broad aspects of wellbeing, organizations risk minimizing attention and resources for mental health issues that exist within their organizations. I think we've all heard of that term yoga in fruit bowls. So when organizations put yoga and fruit bowls in place and call that their initiative to address wellbeing in the workplace, sometimes I wonder if workplace wellbeing programs are the new yoga and fruit bowls. And I would definitely challenge if workplace wellbeing programs are always addressing the specific mental health risks that people are facing within their organizations. By taking a vague approach under that sort of well-being umbrella, organizations are at risk of putting in place initiatives that don't actually get to the key issues that their people are facing. And finally, workplace implications. So most importantly, by placing the focus on well-being, organizations are placing the emphasis on the employee. This means organizations are at risk of treating the employee like a problem to fix and ignores the need for an organizational level systematic approach to address mental health at work. We know that the most effective ways to address mental health at work are taking that organizational level systematic approach and moving away from an individualistic approach. And by taking a well-being perspective, organizations are at risk of focusing too much on the specific employee rather than the broader factors that might impact their mental health at work. So essentially, using a really broad definition of wellbeing can really dilute the focus on mental health and means organizations are more likely to take an ambiguous or a vague approach to the way that they're managing wellbeing. I definitely want to acknowledge, and I think this is a really good place to do it, that there is definitely a place for wellbeing, and in some contexts, it's particularly important. What does spring to mind for me when I'm thinking about wellbeing are models such as Te Whare Tapawha and Hiara Waiora, both which I've worked with before and I think are really fabulous models when we're thinking about wellbeing in a workplace context. Both of the models present wellbeing, mental health as part of the holistic wellbeing of a person and the world that they live in. And I think where these models shine, particularly in the context of what we're talking about today, is they really define what mental health means in the broader context of wellbeing. So they have really clear definitions for what wellbeing means and what mental health means in the context of the broader wellbeing picture, which is what a lot of organizations are missing. And I think brings us very nicely to the next piece, which is around the need for clarity in mental health definitions. So after looking at all of the challenges that we see in terms of well-being and the ambiguity that that term can create in an organizational setting, what can we use from these learnings to create the most impact in our organizations? So the first is the importance of clear definitions. It's really important to be clear in your definitions of what you actually mean by well-being in your organization. It's pretty important to use language that resonates with your people as you're doing that. So that might actually mean that using a term like well-being is something that's best suited for your organization. But what's most important there is actually clearly defining what you mean by well-being and also how you're practically supporting your people in relation to their well-being as it's defined within your organization. The second piece is around addressing specific hazards. So, by taking the time to understand what specific mental health hazards your people are faced with, organizations can develop initiatives, they can develop programs that are actually targeting areas of concern. So rather than taking that broad sweeping well-being approach, by understanding what your hazards are, you have the opportunity to understand what risks your people are exposed to and then build that into your well-being focus. So for example, if you do have a well-being program in place, is that addressing some of your specific mental health hazards? So if we know that your organization is facing things like high workload, low job control, for others it might be things like occupational violence, are those being addressed through your well-being programs? And if not, is your time and money best spent in other areas? And finally, taking a focus on mental health. So by focusing on mental health at the core doesn't mean that other areas of wellbeing can't be considered. And obviously, if we've just been talking about a few of the mental health wellbeing models, if we look at all of the many wellbeing models that exist, we know how intertwined mental health is with all elements of wellbeing that we've been talking about today. But by taking a specific mental health focus, organisations can put in place specific interventions and, most importantly, clear ways of measuring these to make sure they're actually doing their job in managing workplace mental health. So what we've seen to be the most effective is organisations that are taking a really clear and structured approach to mental health using psychosocial risk management, which of course doesn't come without its own challenges. So I would like to hand over to Roberto, who is going to be talking us through some of those specific challenges in terms of psychosocial risk management and how we could learn from those to start addressing some of the gaps in terms of wellbeing.
Great. Thanks, Sam. Appreciate that. So as we've heard, the term well-being, I think, has evolved over time, and we're at a point now where, with the advancement of some regulation in some corners of the world, definitely in the part of the world where I operate in Australia, we've seen some good advancements in this regard, and this has led to this, I guess, interconnected discussion that needs to be had between well-being, mental health, and psychosocial risk management. This is where we're going to try to keep the conversation really focused on, I guess, the link between the two. We need to really define psychosocial risk and psychosocial hazards in order to do that. So maybe, Sam, we'll put the definition up on the screen, and you'll see that psychosocial hazards, by definition, are reasonably complex. So psychosocial hazards are aspects of work that can cause stress and could lead to psychological harm over time. And these stressors can include work design factors, organizational factors, interpersonal factors, work environment, and the content of work itself. So really, when you think about that definition, that gives you a pretty reasonable clue that we're talking about something that is reasonably complex. Just the two highlighted words there give you a significant clue. So we're not talking about aspects of work that cause stress and lead to psychological harm every single time. We're talking about aspects of work that can cause stress and could lead to psychological harm. And when you look at the bottom part of that definition, the stressors can include work design and other factors, we are moving away from an individual focus. And this is what Sam was referring to before, that we need to take a system-focused approach in order to manage psychosocial hazards in the workplace. So what we definitely encourage organizations to do is to focus primarily on three different areas. So you need good governance, leadership, and risk framework. So we'll look at each of those individually. So Sam, you might put the first one up. So when we refer to governance, we're talking about how boards and executive teams are required to demonstrate that they understand the key psychological hazards associated with the organization's operations and are taking appropriate steps to eliminate or mitigate the risk of these hazards. So what we're referring to here is that it all begins with that due diligence at the top, whether the right questions are being asked around mental health and psychosocial risk management in the workplace. A little bit later on, give you some clues in terms of some of those questions and what they should be. So it starts with governance, then it leads to leadership. So leadership is an incredibly important element in the control environment for psychosocial hazards. In fact, leadership together with work design are two of the primary evidence-based controls that organizations should be looking at in relation to managing psychosocial risk in the workplace, advancing mental health and well-being. And organizations, obviously, if we're looking at leadership, they will need to demonstrate how they train, develop, and monitor leadership and its impact on employees' mental health. The third element here is all about risk management. So we'll show that one, Sam. So risk management, and the main point here is that new risk management frameworks are required to accommodate the complex, nonlinear, and multifaceted nature of psychosocial hazards. What we know is that traditional models of risk management won't cater for the complexity of psychosocial risk. They won't cater for the systematic approach, but taking the individual context in place, and therefore can very quickly fall short of what the requirements are. And when we talk about the regulatory framework, that'll become apparent. So let's unpack the challenge a little bit. So there's a handful of challenges that I think all of us that are interested in well-being in the workplace, mental health, psychosocial risk management should really be focused on. So these will very much cover, I guess, how psychosocial risk thinking is evolving now into the regulatory space, but beyond that. So the first challenge is the fact that we've got limited understanding of that complexity. So in order to manage psychosocial risk effectively in the workplace, we need to account for things like the duration, the frequency, and the severity of that exposure, plus how that interacts within the work context. And all of that happens together with an individual, set of reactions. And if we put the next one up, we'll see how this is very different to the way that we look at current work health and safety risks, so the more traditional safety risk, which are limited primarily to consequence and likelihood. So what we know is that with a physical risk context, if you're exposed, for example, to falling from heights or a falling object, or you're going into a confined space, or you're going into a place where there might be exposure to chemicals, what we know is that we can expect that interaction to lead to a level of harm. We know that it is pretty predictable. It is fairly linear, depending on, for example, how far from height you fall. The impact will be there. When it comes to psychosocial risk and mental health in the workplace, that's very different, because you could have two different people, for example, exposed to exactly the same stressor. One person could have a very adverse reaction to that stressor. The other person could be totally fine. So there's a degree of complexity. The context is important. The individual elements are very important when it comes to mental health and psychosocial risk. The next is the fact that even with the advancements in regulation, and I know that this is primarily here in Australia, this should give you a bit of an idea of, even though we're talking about it, even though it's been regulated and it's been advanced, it's still not necessarily consistent. So we have this inconsistent regulatory guidance. Just some examples there. In Victoria, for example, exposure equals duration plus frequency times the likelihood. In New South Wales, that changes a little bit, where it is the consequence of exposure, duration, and possible harm. So even adding words like possible can change the definition and can change the focus for people trying to work through that regulatory framework. In Queensland, you have duration, frequency, and severity. In New Zealand, we have draft as well. So you can see that it really does change the way that you might be looking at it, depending on how the regulatory framework is guiding your thinking. We are moving towards more harmonised models, but we're not quite there yet. So the intersecting legislative requirements is also another important challenge to think about when it comes to mental health and psychosocial risk. We're not just referring to work health and safety legislation and the associated regs and codes of practice, because you need to look at things like fair work, sex discrimination, workplace gender equality acts, all of which have elements of mental health, wellbeing, psychosocial risk management throughout. So it's not just one specific regulatory framework, and hopefully what we see is that advancements in these can lead to a clear path forward for how we manage psychosocial risk and mental health in the workplace. Adding to all of that, you have this lack of clarity of roles and responsibilities. So depending on which side of the fence you're on, whether you're on the health and safety side or human resources side or people and culture side, you might have slightly different views on where this gets managed, who has the responsibility, and more importantly, how this should be managed. And I think that what we want to see going forward is a more integrated approach between the way that health and safety and people and culture look at the management of mental health, wellbeing, and psychosocial risk in the workplace. The answer, obviously, is it doesn't rest with one, it rests with all the supportive functions and guiding businesses through the complexities of how we manage those. And the final point here is around inadequate data and systems. So I don't think we need to elaborate on this too much. When you look at that through psychosocial risk management lens, that becomes even more apparent. If we think about how organisations are going to show that they're demonstrating that they've got adequate controls in place and that those controls are working for psychosocial risk management, that should give you a little bit of a clue of just how complex the challenge is. So yes, we want to talk about this in the fact that it is complex. There's quite a lot to think about. However, there is a way forward here, and we believe that it will require an integrated approach. Thanks, Sam. So what we want to highlight here is that we don't need a human-centric approach or a system-based approach. We actually need both. It is incredibly important that we understand the impact that the elements that we put for people to do their work under the system of work for humans so they're able to thrive in the workplace. And essentially that's what we're talking about here. When we refer to the system, we're talking about things like the processes, the procedures, the structures, the resources, the governance frameworks, even how we use digital technology in the workplace. If these things are geared correctly and they're helping individuals thrive in the workplace, then you will see that benefit pay back in spades. And when we're referring to the human, of course, we're talking about how leadership gets used in the workplace for good. The capabilities that people show, the attitudes that people bring to work, the culture, psychological safety, and people being able to speak out and just without the fear of repercussion. So if that is the case, then humans will naturally start thinking about how to improve the system, how to innovate, and that therefore impacts the system itself. And so you can get into this really positive perpetual cycle around helping humans thrive in the workplace. Of course, the opposite can happen where the systems are not geared towards helping people. They actually get in the way and cause frustration and more stress. And I don't think we need to elaborate too much on what the impact of that ultimately is. So I guess the overarching message here is that we need to think about how we get these two sides of the equation working for our organisations and not against the organisations. And that is really at the heart of the whole psychosocial risk equation. And that taps into obviously what we've been talking about in relation to mental health and also well-being. So what just want to highlight is just a handful of questions I guess the board should be asking, or that executive leaders should really be thinking about when it comes to managing psychosocial risk in the workplace. And these questions are not necessarily rocket science. They need to go to the basics. So in Australia, for example, there are some very specific things that organisations need to do in order to effectively manage psychosocial risk in the workplace. And it all starts with having a systematic approach to managing psychosocial risk. So it's not an ad hoc approach or it depends approach. It's a systematic approach to managing psychosocial risk. And therefore, that should be the first question that should be asked by board members to, I guess, look at really closely at the due diligence of managing psychosocial risk. So how can we demonstrate that we have a systematic approach to managing psychosocial risk? How do we actually assess psychosocial risk in the workplace? How often? By who? What do we do with those insights? The second point is, well, how do we know the level of risk that we carry in the workplace? Are we making assumptions that one place is the same as the other? The one business unit has the same level of risk as another business unit? Often the answer to that is no. And that is well documented in the regulatory frameworks. Another question is, well, how do we know that the controls that we have in place are indeed effective? Do we know whether the controls that we have in place come from a position of evidence? Are they evidence informed, at least? When was the last time that we really looked at the literature in relation to some of the controls that we have put in place? And this is something that Sam was referring to before, that sometimes we have quite a number of controls or supposed controls in place, and yet we're not questioning the efficacy of those controls. And the last one is very simply around how do we make sure that we have an ability to systematically assess the effectiveness of those controls that we have in place. What does that look like? What kind of things do we need to put in place now so that we're able to eventually be able to say, hang on hard, those controls are actually working, improving people's experience at work, mental health, psychosocial risk. So that's just a handful of questions. Okay.
From a strategic leadership perspective, you've mentioned leadership and all that governance components. What do you consider, in your experience, the most critical challenge related to mental health in organizations today that's faced by that leadership group, whether it's your senior leadership executive team or your board and officers? So what's the most critical challenge that they're facing in your experience? Good for them to know what those critical challenges are. And then from that leadership point of view, how have you found the really best way to effectively address that critical challenge in driving both employee well-being and business performance? You've got both balances of things, right?
Yeah, absolutely, Craig. And look, there's a few challenges, to be fair, The one that is pretty obvious is that you are fairly dependent. If you're a leader within the business and you're trying to impact positively, people's experience in the workplace, you are faced with the systems of work that you have. So, if you look at that slide on the right-hand side, the procedures, the processes, the structures, and the resources are either going to be working for you or against you. So imagine you're a very conscious leader and you're trying to do the right thing, and you're working within a system that frustrates people. They don't have the appropriate resources. They're constantly fighting against the way that the processes are meant to be run. Then you've got one positive element fighting against one that is not necessarily all that positive. And that's generally what it looks like. Opposite to that, though, you do see the other end of the equation, where an organization has they've really thought about simplification of systems and processes, for example, to make sure that people can engage with those, but they haven't invested in the leadership capability. So you're just hoping that leaders are able to somehow, through their journey, work out how to best and possibly influence the workplace and the culture. So you've got a competing kind of energies there from both the system and the human side. And then what that generally leads to, Craig, to be fair, is significant inconsistency in that leadership execution.
Awesome. Thanks.
Yeah. So really, in order to be able to, get to a position of, where we move forward, it is really a question of investment. Ultimately, we're talking about investing in leaders, being able to invest in the systems of work. If we can get leaders geared toward helping people in the workplace and having enough skills to be able to do that, and then the systems of work are favorable, that allows that leadership to come through in the end. So I think in relation to the main challenge, this is what we propose, is that we look at a human and a system integrated approach.
So I do wonder what about working more in the preventative space when challenges are identified? Hazards point out, often the harm is already done. Are there any predictors known? Has any research been done that can be identified managing psychosocial hazards earlier? And yes, Karina, lots of research that has been done. And I think this is very much where the sort of guidance is taking us in terms of shifting to more of a preventative approach to managing psychosocial risk. So in terms of predictors known, interesting question. I would say in terms of shifting to taking more of a prevention-based approach, the important things would be looking at your risk management models that you have in place, making sure that you clearly understand what your psychosocial hazards are and your risks, looking at the data that you have available in terms of identifying where you might have hotspots emerging to identify, emerging psychosocial hazards, and also looking at where you can apply things like the hierarchy of control or preventative controls in terms of some of those hazards that you've identified. So really about understanding what your specific psychosocial risks are so that you can target some of those preventative controls.
Cool. Thanks, Sam. And it really goes into, we've given a lot of facts, a lot of background, a lot of your opinion, your experience in this process. How can organizations measure the success of their mental health and wellbeing programs? And this is beyond employee satisfaction surveys that might go around once a year, and no one's going to be honest with them anyway. So in your experience, or what do you recommend that organizations use to measure their mental health and wellbeing program success?
Yeah, I might jump in with this one, Sam, if you're okay with it. So, Craig, really interesting one, because the answer to this also relates to general health and safety, really. So what psychosocial risk management and I guess mental health and wellbeing to some extent provided an opportunity to set up a longitudinal way of working out whether things are actually working effectively or not. So the good thing is, if you're implementing a new solution, for example, for psychosocial risk management, you have the opportunity to set up that evaluation framework at the outset. You're not dealing with 3, 5, 10 years of legacy of that initiative being in place and then trying to work out retrospectively whether it's working. So what we generally suggest is that you look at a prospective evaluation model, which means that, as Sam was saying before, that you are looking for a very specific relationship between the control or the initiative in place and what you're trying to impact from a mental health psychosocial risk perspective. So one simple way to explain it is to use training as a way of thinking about this. So if you're implementing some new training to create awareness, to provide people with insight, then the best way to measure whether that's working is to test whether people are actually taking the training transfer forward. So instead of asking people whether they liked the training or whether they found it to be useful, you should ask about, the key elements that they took away from that straight after the training. You should then be able to evaluate whether that consistently continues over a period of time, and whether, let's say, in a month or two, that training has still been transferred, whether they still recall the key elements of that training initiative, for example. If the answer is no, then you could continue to ask people, you can continue to run that training even, but you might find very quickly that it's not actually working because people are not able to recall even the basics of that training. So just having the training element or that training programming on your books doesn't really, it's not leading to anything impactful in the end. So I guess we do need to shift away from, the likability type questions and what people thought about things, but we need to then be prepared. And I guess this is where it's a little bit more complex than the traditional answer. You've got to be prepared to then follow that through with some systematic way of evaluating that impact over time, and not just a quick survey.
Yeah.
So
anything to add to that, Sam?
The only thing that I would add is just in terms of, Bert's talking about measurement of specific initiatives, and I think when we're talking a little bit more broadly around measurement of trends in terms of psychosocial hazards in the workplace generally. The only thing that I'd add is challenge what data you are looking at when you're looking at mental health and wellbeing data. So traditionally, we do see organizations relying really heavily on their employee annual survey results, and that's the only point of data that they have that they're collecting on mental health in the workplace. There's so many other points of data that could either be used now actively, are probably already collecting points on mental health in the workplace, or could be adapted slightly so that they are collecting data points in terms of mental health in the workplace. So I'm thinking things like, depending on how your incident system and reporting system set up, making sure that that's capturing psychosocial incidents as well as physical incidents. But there's still the opportunity to be capturing that information through your incident reporting systems. There is also the ability to think about different ways that you can use HR data in terms of, absenteeism, presenteeism, number of hours worked, to inform different trends that might be occurring in your organization in terms of different psychosocial hazards. And that'll let you be a lot more targeted in terms of putting in place some of the initiatives in the first place. And then that's where the monitoring and evaluation piece that Roberto was talking about comes into place just after that.
Confidentiality required around psychosocial risk, and do we need to be more careful around data entered into our USMS software for those logged incidents? I've got a point to that to make, but from a software point of view, so EcoPortal, we run a really robust confidential workflow that can either be an automated workflow based on the type of incident that's selected by the immediate user that's creating the entry, or it could be a prompt or a question that's the user simply presses yes or no. And then in the background business rules of that workflow template, that whole entry is then escalated or sent to a specific user group, and no one but that user group and the individual would see that entry. So no manager, no team lead, no health and safety team, if that's not the confidential work team, would ever see that entry. So your software should be good enough, or you should move to good software that actually provides a confidential workflow to manage that process. So that's from a software point of view. From an organizational development point of view, any thoughts around that confidential space?
Yeah. So I think here this is very dependent in terms of how organizations are running this. It's very dependent, again, on what systems and processes they do have set up internally. I would say it's one of two ways. If the system doesn't have the capability to manage the confidentiality requirements of any psychosocial risk incidents, then they might have a completely separate process that their psychosocial incidents are reported through. And it might go directly to someone in HR, for example, depending on what the structures look like. I would say that approach can create some disconnect with the way psychosocial risk is managed. And so the second approach is the one that I think works better and have seen work better, is in terms of having it integrated into your existing systems, but having those checks and balances and controls in your systems, so that you are able to manage the confidentiality requirements, but also still are capturing the data and encouraging people to report through those systems. The confidentiality aspect is a really important one, though, and something that we definitely have to be really mindful of around psychosocial risk, because if it isn't done well, then you'll immediately lose trust from your people in terms of reporting, and then you miss a whole lot of data and miss the opportunity to be managing that for your people.
One of our larger challenges in retail is the uplift in customer person aggression. We can't stop the customer walking in the door, that's their business, and we provide relevant training and de-escalation. But of course, the challenge is the attitudes before they're pushed upon our workers, especially younger staff. Any thoughts to that?
Yes. I saw another question around, the kind of inherent challenges associated with some roles. So if you think of first responders, fairly similar, there are some roles where that interaction with the public is a reality, and it's very, very challenging. And we definitely have seen in the retail space that escalate quite a bit, particularly in the face of COVID, as we all know, that's created additional challenges. So one of the first things is very much to recognise that is part of the mix going forward. So there are some roles that inherently will be exposed to that type of psychosocial hazard. So the customer aggression. The other thing to recognise is that going back to a point that I made a little bit earlier, is that different people will react differently to that aggression from the start all the way through to obviously a position of, it's not appropriate for anybody. Younger people, of course, need to be considered within that mix. That some of the most vulnerable people may not have the appropriate life experience or the set of skills developed over time to be able to, appropriately de-escalate a situation, or be able to deal with something that can escalate quite quickly. So we need to be very, very conscious of that. So if we are conscious of that and we know that that is going to be something that is a high potential, then we can then start putting the appropriate systems in place from the education. But beyond low-level controls, Craig, would be one of the things that I would say, is that we can't just rely on, the procedure or the training. We need to start thinking about, all the way to work design and even some engineering level controls in order to minimize that exposure. And that is the reality in some places, particularly retail spaces that are opened late at night, for example, where you unfortunately have to go down the path of, barriers and limiting the ability for that aggressor to interact with your staff.
Mm.
Interestingly, we've I'll say you guys, Sam, please, before
I think it's a really interesting one because it's something that we see quite a lot, and I would say particularly in New Zealand, there's a real sort of social context happening behind the increase in customer aggression. But I always say if you're customer facing, you're seeing an increase in customer aggression at the moment. It doesn't necessarily have to be retail; it just has to be any type of industry that has a customer facing element. For me, I think the focus often is on reducing physical exposure, as it should be, because that's a significant risk to people, particularly in retail environments. We've seen examples of where, if the controls aren't in place, that things can go really wrong from a physical perspective. But just coming back to this model here, I think it's also really important to think about the human aspects of managing that risk of violence in the workplace, and some of the psychological impacts that has on people. So not just focusing necessarily on controls to protect people physically, but also giving them the tools to protect themselves psychologically or psychosocially in that environment as well. And also another thing that I think is really important in terms of the way organizations are managing that increase of violence is taking a look at other industries outside that might have been exposed to it for longer. So, areas like healthcare or first responders who might have been doing this for a little bit longer, and looking at how to apply those into some other environments such as retail, as well as looking at technological interventions in different ways that technology could be used to support people.
Is there a good news story that you can share regarding a specific psychosocial hazard that you've seen in your consulting world? Maybe a high workload or OCC violence, and then a specific control that was applied, and then actually worked really, really well to address that. Do you have any good feel-good stories?
Sam, do you want me to jump in?
How about you go first, and then I've got one as well.
Okay, no worries. Sounds good. So one that I think touches partially on that previous point around customer aggression, and also partially on the point that I made that maybe we need to start thinking about engineering level controls. So one example that I've got is, and again, this won't be necessarily applicable to everyone on the call, depending on the size of the business, but this particular business deals a lot with customer aggression over the phone. So what that organization decided was that so traditionally what would happen, I'll provide the quick story, is that if someone was being aggressive over the phone, it would be up to the individual on the receiving end to then tap out to say, I've had enough of the aggression or the verbal abuse, or engage their leader once they thought that he crossed the line. What this business decided to do was to implement a digital technology solution with appropriate algorithms that would pick up on tone of voice, language being used, and what that would typically do is get to a point where the system would decide that the call is inappropriate, and the system would decide to then bypass that individual that's on the receiving end, and that call would automatically either be terminated depending on the level of aggression, or it would go to the individual's manager to then respond appropriately. And then on top of that, they would monitor the number of those calls an individual had to be on the receiving end of, and the system would then limit that through, again, a digital algorithm to be able to then hopefully protect individuals from that exposure. So that is an example of kind of thinking about the fact that you're going to have this type of call, not ignoring. You know that you don't live in an ideal world. We're not talking about perfection here. Someone will get aggressive over the phone. So therefore, how can we mitigate that that level of exposure through digital / engineering level controls instead of leaving the humans to deal with it?
It's really, really clever. Great story. Thanks, Bert.
You
Sam,
almost
what's your
stole mine
good
there,
news story?
Roberto. But the one that you chose is too close to the similar to the one that I had, so I'm going to go for something different instead. Another organization that I can think of, a good example of a sort of good news story. So it's an engineering organization. They work in the mining sector. They have a large portion of their workforce that is frontline. They're out fixing assets on a day-to-day basis. One of the challenges that they had with the frontline workforce was, from a psychosocial risk perspective, was a lack of flexibility in their working. And one of the challenges that would always come back from leadership was, well, you have to be out there doing the work. We can't create flexible working for you because you can't be working from home. You need to be out there delivering the work, obviously. And I would say that that's something that we often hear in organizations like that, and very realistically and validly so, because they do need to be out there. And so one of the things that this organization did was actually step back and look at the work setups that they have, look at the design of their work systems, and really challenge some of their, I would say, historic assumptions around how people had to work when it came to those guys that are out in the field delivering their engineering services. And they changed their entire rostering system to create an additional level of flexibility for their frontline workers so that they did have the opportunity to choose their shifts a lot more flexibly, and really addressing that challenge around lack of flexibility in work. So I think what I really like about this was it was such a good news story for the organization. It really, really helped the team feel as if they were being heard in terms of some of the challenges that they had been talking about for a really long time. Really good example of leadership challenging some of the assumptions around how you must work in an organization, and how things have always been done. And also a really good example of taking an organizational level approach to addressing a specific psychosocial hazard.
Awesome. Thank you. I got one more question that I want to ask. Maybe you can give me a short and sweet 1 minute answer each to this one. What advice would you give to leaders who are just starting to address mental health in their organizations, but have no idea where to begin? They don't know where to begin. It's the first time they're doing it, but they're really passionate. They want to do the right thing. What would be maybe your first couple of things that you'd recommend an organization to do for the first ever time in this space?
Sam, do you want to go?
Do you want me to go first? I can go first. I would bring it back to this model. I would take a look at the model you've got in front of you and make sure that you're considering both the human and the system elements when you're thinking about how you want to be running, managing psychosocial risk in your organization. Do you have the right systems in place in terms of, your procedures, your processes, your structures, asking yourself some of the questions that Roberto had gone through earlier, but also, very importantly, the human aspect, talking to your people. I think the most important piece is getting out there, understanding your risks by talking to your people, and understanding things from their perspective. Because in terms of putting in place controls and more effectively managing mental health, it is so dependent on the organization and the organizational context. And the only way that you're going to be able to do that is to get out and talk to people about what's going to specifically work for them.
Brilliant. Thank you, Sam. I'll cut that there, and Bert, you get one minute for your last answer.
Yeah, so my one simply is don't rely on surveys. We need to go beyond survey responses. I think that there's a place for that, but like Sam said, you need to follow that up with a two-way conversation, because when it comes to mental health, psychosocial risk, you can make a lot of assumptions based on survey responses. You need to actually get out there and understand what people's pain points are.
Brilliant. Thank you, Bert. So everyone, it looks like that's the end of our time today. How time does fly when you're having super fun. Thank you, Sam. Thank you, Bert, for an invigorating, enlightening, fascinating conversation. Really thank you. And thank you for everyone who joined us today. Empowering ourselves with information and engaging in this dialogue is what makes and what takes safety culture to the next level. So thank you for everyone for your input.
Awesome. Thank you so much, Craig. This has been really great.
Awesome.
Yeah, great. Thank you, Craig. Appreciate the time.
Thanks, Bert. Thank you for listening to safetyCast. If you enjoyed this episode, please like, subscribe, and share with your colleagues, because safety knowledge is meant to be shared. Stay safe, stay engaged, and be sure to catch our next episode for more expert insights. See you then.